Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest is Brian Drosterowitz, Chief Revenue Officer at PointClickCare. Welcome, Brian.
Thanks for having me. Happy to be here today.
Appreciate you coming over here. Busy health conference, lots to talk about. But before we go there, tell us about yourself and PointClickCare.
Yeah, so Chief Revenue Officer at PointClickCare, been here about 3 years.
Wow.
So joined to run our hospital and health plan division, recently moved over to the CRO role.
Oh, awesome. Well, PointClickCare just unveiled its new branding here at Health. Congratulations to you and your team.
Yeah, big week for us.
Yeah, that's a lot of work. But talk to us, how does this transformation kind of reflect the company's next chapter and also kind of the message that it aims to send to the industry and maybe broader healthcare ecosystem in general?
Yeah. So we're I think a generally well-known entity in the space, been around a long time. Our rebranding really reflects centering in on our mission, which is to help every provider provide exceptional care. The rebranding really focuses in on the provider and the broad set of capabilities across all the different care settings. We're traditionally known for the work that we've done in post-acute, skilled nursing, assisted living, but we've recently made a lot of investments and really filled in the gaps in a lot of the spaces, before patients become a post-acute patient. Understanding transitions of care, quality gaps, and really focusing in on the provider.
Yeah, I mean, talking about that, your refreshed brand really does put the provider at the center. I think that was an interesting part of it. Like, what inspired this shift, and how does it maybe reflect your company's longer term vision for healthcare technology?
Yeah, look, where we do so much work in the post-acute segment, and time and care by providers is a difficult thing to manage and watch. They're stressed, they've got a tremendous burden in their day-to-day, and we're really focused on allowing them to perform at the top of their license, focusing on patient care, and really be more focused on the patient. So it's for us, anything that we can do to provide that, or to give that provider the ability to give that focus is time well spent.
Yeah, I always find it interesting. People are like, well, technology makes it less human. But you're like, no, technology takes the mundane so the humans can be human.
Yeah.
And I think that's what you kind of just described.
Look, if I don't know how many times I've been to my physician where they've got their head in the computer and they're going through their checklist of things that they need to document. Anything that we can do to help that provider, provide better care, and simplify and drive efficiency in what they need to document, for quality, for revenue, is time well spent, and we've really invested heavily in that in the past couple of years.
Yeah, that's awesome. Well, no surprise, you're also showcasing some new AI-powered solutions here at Health. Tell us about these new innovations and how are they helping providers improve the quality of the care that they provide? Yeah,
so probably there's a lot that we're doing. We've invested heavily in AI. Past probably 2 years have been years of very heavy investment in AI for us, both in how we build, which is really important because you get a lot of efficiency. There's a lot of technology companies here that are focused, around the efficiencies that you get with AI, but also the commercial offerings that we brought to market. So we've got a couple of big ones that have had great early market feedback. Probably the biggest one for us this week that we're talking about is Chart Advisor, which is a tool that is embedded within our skilled nursing EHR. And if you think about the EHR, again, going back to what I talked about with physicians, head in the computer, they're heavy on the documentation, they're working through their checklist and all the things that they need to do when you're there. A lot of that gets actually captured in free text notes and in like a progress note or discharge summary.
Sure.
You've been to a doctor and post-discharge you get like your stack of paper with a whole bunch of notes in it. What Chart Advisor does is it looks through all that open text, large language model, and we've trained it to look for a couple of very specific things from a liability standpoint reimbursement or quality standpoint for the physician where there may be vulnerability. So our first area looking at skilled nursing is on falls. And if the patient has had a fall, there's a whole bunch of assessments that need to happen to ensure that patient's getting proper care. That's not always captured in structured, field documentation within the EHR. So this large language model is looking at that unstructured free text, looking for vulnerabilities there, then flagging that, and then essentially driving a workflow for the clinician to ensure that the right thing then happens. Again, you think about skilled nursing, there's staff challenges, there's time challenges, care around the clock, ensuring that things are properly documented and that patient gets the appropriate care is absolutely critical.
That's interesting. I want to learn more about Chart Advisor. It sounds like a really interesting product. I know you just launched it in limited availability. So what documents is it looking at? Is it scanned in documents? Is it fax documents? Is it documents within the system?
So it's free text documentation within the EHR on a progress note. So with every interaction that a provider has in our EHR, in most cases they're charting an assessment, vitals, that sort of thing. And then they've got the ability to, free key in, their observations into that progress note. That progress note can contain all sorts of things.
Sure.
What is top of mind for that provider at that point in time, they're going to write there. They don't always capture that in other structured documentation, which would be like drop-down fields within the assessment. You get all those questions from your provider. It feels a little robotic at times, and they try and make that a very personal interaction by having a conversation with you and not just running through that list. If they run through that list, like they're filling out their structured documentation, you got to check the box. Right. That's how they get paid. That's how they, that's how that all works. The progress note is essentially the conversation, and that's where all the observations will occur. We're scrubbing that whole progress note, looking for anything that may be indicative of something that could be a risk for the provider or the patient.
Yeah, that's fascinating. I love that you're looking through all of the note to find those risks and be able to highlight those areas, like you said, a fall risk or things like that might be really important for the care of the patient. I think the other interesting thing for me with PointClickCare is how much you've grown. Yeah. Obviously, your origins come from the post-acute care, but you've grown into the hospitals, health systems, across the full healthcare ecosystem. I'd love to hear, I think you talk about it as an integrated ecosystem, right? Across all of the organizations, because as patients, for us, it's just healthcare, right? It sounds like you're treating it that same way. How does PointClickCare's platform bring together the data from all of these different systems, and why does it matter for providers and payers that you have that whole ecosystem view?
Yeah. So we've had a really strong growth trajectory over our entirety of existence here, over 25 years or so. Most people know PointClickCare for our post-acute business, which we're the market leader in. We've invested heavily in, as I mentioned, what happens before and after a patient ends up in that post-acute facility. So right now we've got the largest network of data for when you combine acute and post-acute. We're connected to more than 50% of hospitals in the US.
Wow.
We of course have our large install base of SNF, senior living, AL, IL, et cetera. And what really makes that unique is we follow the patient throughout their entirety of the journey within the ecosystem, track that patient, and then because we know where a patient is going to be, because we have all those nodes on our network, provide alerting services out to care teams, providers, when some sort of event happens. If I get services out of network, if I visit an emergency room on vacation, if I see a specialist that might be out of network, all of those alerts can be triggered to be sent back to your PCP, back to your health plan, back to your providers to make sure that the appropriate follow-up care, gaps in care, and that quality is assured throughout that journey. So having full visibility of patients across the ecosystem is really, really important. And we're going to continue to invest in ways that connect all of those disparate systems. It's great to have the best documentation at the moment, when you're with that patient to ensure quality there. But healthcare is about the whole spectrum and what happens before and what happens after. And if you zoom out, in order to do that, you really need to have full visibility across the spectrum. We've recognized that's a very bold thing to chase, but we continue to build this network. It's been super valuable for us, and that's really helped to drive a lot of the growth that we've had.
That's great. What would you say is on the horizon for PointClickCare, and how are you looking to put forward that next innovation to continue to empower providers, as we kind of talked about before?
Yeah, I think that there's a lot that we're investing in now relative to transitions in care. Our customers are challenging us more, because we have this broad network. They want to know what happens, in full detail before a patient shows up at a SNF. They want to know, why a patient shows back up in the emergency department. Helping to really inform care teams to take the appropriate action when those sort of events happen. And really to help leverage or to leverage the newest technology, in our case, heavy investment in AI, to make that interaction with the patient as efficient as possible. So heavy investment in the tooling. I think you'll see a lot of AI offerings hit the market over the next couple of years. It's something we're truly committed to help again, get back to our mission to help every provider provide exceptional care. Bold mission, but big investment on our part to get there.
Yeah, that makes sense. Well, Brian, I appreciate all the work you're doing, you and the team at PointClickCare, to help bridge that gap across the healthcare ecosystem, be able to provide the highest quality care for the patients and improve the lives of providers. So thanks for sitting down and talking with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Brian.
Thanks for having me.